Hello and welcome to this channel. We are going to discuss about abdominal aorta. It begins in the midline of aortic opening of diaphragm opposite to T12 vertebra and passes downwards and left slightly. It ends at lower part of the body of L4 vertebra and 1.25 centimeter left of medial plane and divides into right and left common iliac branches. It has forward convexity so that for this pulsations can be felt in the region of umbilicus when pressed. And relations from above downwards anteriorly we have celiac and aortic plexuses, body of pancreas, which is where there is a splenic vein embedded in the posterior surface of the pancreas at that level, and third part of duodenum. Posteriorly we have bodies of upper four lumbar vertebra, anterior longitudinal ligament of vertebral column. To the right side of the aorta there are inferior vena cava, right diaphragmic crus, and cisterna chyli, and which is a lymphatic duct, and azygos vein in the upper part. And in the left side from above downwards there are left crus of diaphragm, pancreas, and fourth duodenal part. This abdominal aorta is going to have several parts, so individual there are also several branches, and the diagram I'll draw the diagrams of the branches separately, okay, in the next upcoming videos. Sorry, cisterna chyli are actually lymphatic sacs which connect the thoracic duct, okay.